Meantime, there's been a major milestone. U.S. health regulators have authorized the first pill to fight COVID-19. The Pfizer drug will be available by prescription, but initial supplies will be extremely limited. It's been cleared for people 12 years and older who test positive for COVID-19 and face the highest risk of hospitalization. The drug is touted as a faster and cheaper way to treat COVID and reduce the risk of hospitalization and death. Well, the authorization comes as the number of COVID-19 deaths continue to climb. In Lancaster County, there have been a record number of hospitalizations in just the last week. Brian Munoz is live in Lancaster to explain the surge. Brian.
COVID deaths are trending upward again, similar to the start of the pandemic, which one local doctor says is very concerning. Lancaster County is on watch. Hospitals are packed to the brim, and now deaths are surging. The county is on pace to reach a pandemic high with 85 deaths so far this month.
So what we are seeing is a pretty strong increase in cases. We are actually close to our peak from last winter,
but far lower than the 207 recorded deaths in December 2020. And with more vaccines going into arms and multiple preventative measures in the medical toolbox, why is it the death toll is still rising at such alarming rates? Dr. Goldman says it's the pandemic of the willing, not so much that vaccines aren't working.
We have a much lower rate of vaccination among younger people. And as a result, we have many more younger people in the hospital.
He also says this latest strain is so infectious, it should alarm everyone.
The original strain of COVID probably infected 2 to 3 people for every person with COVID. The Delta variant probably infected 4 to 6 people for every person with COVID. And the Omicron variant probably infects 8 to 12.
For now, Dr. Goldman says the safest bet is to get vaccinated and boosted if you haven't. Live in Lancaster, Brian Munoz, ABC 27 News.